Mansir Nasir. I work with Family Health International under the Global HIV/AIDS Initiative. In Nigeria, I'm the Strategic Behavior Communication Officer for Bauchi Zonal Office. I started with Ku Saurara, I think in 2001. I was involved as a radio presenter to present the magazine program for Ku Saurara alongside with a co-host. And from there, I became a script writer. I also became a peer educator and subsequently a member of the Ku Saurara steering committee. That is under the NGO I worked for then. Basically, that is the start way back in 2001. So it's been a process, it's been a process that has developed, and I have also developed with it. The home video part of it coming into play, I being part of the team that developed it, and a whole lot of other things. Also the road shows and all that, I was part of it. So it's been a process that, has improved me personally, and I guess it was a start to getting me where I am today. Ku Saurara being a reproductive health program, and especially for northern Nigeria, which is somewhat very conservative, religious, and a bit culturally sensitive. So actually talking about issues to do with reproductive health, that's sexuality, with young people, it's almost like a no-go area, and especially using mass mediums like radio, road shows and all that. So there was that challenge initially, but I guess with a very strong advocacy, especially from the background of Johns Hopkins CCP, of course the whole strategic communication team coming into place. I think involving the gatekeepers actually at very high levels was quite instrumental to breaking that barrier. But again, it wasn't easy, especially on radio. There have to be a lot of meetings, a lot of this, a lot of that, but eventually it was overdone. But it was a very, very strong challenge. And additionally, the whole Ku Saurara thing was piloting quite a new thing, you understand? So people getting adjusted to the whole concept, the whole idea, even the technical crew, which I was part of, it was a new thing. It had to have a certain level of quality, and so chunking out, media materials, most especially the radio program, which I was part of from start, it was a very challenging, and it was quite revolutionary in itself. So those were some of the challenges we faced actually, but along the line, having a lot of professionals and developing ourselves, we're able to master it, and I guess it was effective. Coming from, again, the conservative northern Nigeria setting, young people have not actually had the opportunity to express themselves, and even programs you find on radio, TV, or anything do not actually put young people in focus. And young people make up, I think, the largest percentage of the Nigerian population. And you would observe that in northern Nigeria, there are a lot of issues relating to young people, be it about sexuality, about social vices. Young people are involved in drugs, and people are involved in unwanted pregnancies, abortions, and all that. But again, these issues remain silent. Nobody was actually bringing them to the forefront. And so Ku Saurara actually provided that platform where young people could be part of the whole process of developing and conceptualizing the program, and also implementing the program. So it gave a voice to young people, so it was a revolution in itself. And a lot of people now are aware, young people are aware that they have the right to know about their sexuality, they have the right to access youth-friendly services and facilities. Do you understand? And also in the aspect of healthcare provision, you find health workers are not actually receptive to young people as a result of all these cultural insensitivities that I mentioned. They feel young people have no right to come asking about sexuality. So Ku Saurara actually brought that opportunity for even the health workers, where it brought them down and say, hey guys, look, young people also have the right to access health services, and it gave them the skills in terms of building interpersonal communication and counseling skills for young people, for healthcare providers, where they're able to provide youth-friendly services. So that itself is a revolution in itself. When you come with a program for a specific target audience, and then you sit down in your boardroom, you develop everything, and then you bring it out, you're not putting into context, the reality of that these people might have a say. So I guess a very strong point of the Ku Saurara project was involving young people like myself in the whole, conceptualization process. And that has actually built a lot of skills. I know myself now, I work with a USAID funded project full time, and I have done various consultancies in the past for DFID, USAID and all. And also some colleagues of mine whom we started together. And along the line, we have also built a crop of people behind us. So that itself involving the key stakeholders in this, in reproductive health, most especially adolescent reproductive health. That I think is one of the key elements that makes the project stand out. As we know, looking at statistics, the Sentinel survey in Nigeria, you'd observe that there's still a lot of issues. There's still a lot of concern about reproductive health in northern Nigeria, most especially young adolescents who are getting married. There is a lot of work still needs to be done. Young people are still, having abortions. Young people, are still having unwanted and early pregnancies. HIV/AIDS, is on the increase, especially with young people. So young people still engage in risky behaviors. I'm not saying Ku Saurara hasn't achieved anything, but again, Nigeria has a very large population, and northern Nigeria has a very large population. So we access to family planning services still low, notwithstanding the effort of programs like Ku Saurara and other development agencies. So we still haven't got there actually, but we have started a process, and I think we can get to a stage where we can comfortably say we have seen a large impact and sustainability will carry on. But at this stage, I think we have still not gotten there. So that should be a justification for continuation. Personally, I was working with the Kaduna State Media Corporation, actually, KSMC FM, as a youth presenter. That was when I got involved with Ku Saurara. And before then, myself, I wasn't actually aware of most of this reproductive health, issues. I didn't care, about them. There weren't issues that were important to me. Yeah, I knew young people had social vices, but yeah, what the hell? I didn't care. But, the project actually made me understand that I can also have a role in determining the future of a lot of young people. And it also enriched me with knowledge, actually, and also skills to be able to convey very sensitive messages to young people in a very culturally sensitive environment. And it provided me opportunity for trainings, workshops, seminars and all that. It actually funded my participation in the Make a Difference advances in health communication, which was a very important eye-opener. That led to improving my personal and even organizational skills. That I was able to set up a non-governmental organization and also a community-based organization in my community, which has actually conveyed the message of Ku Saurara and even other projects, other development projects. And I would say it was the beginning of getting me where I am today, being deep involved in development work, reproductive health, and other issues. So I would say it has built my capacity. I think it's all about the capacity building in itself, not just me, not just young people, healthcare providers, and even NGOs, in Kano, Kaduna, all the places where Ku Saurara has worked. It has provided opportunity for organizations to develop themselves, you understand, in terms of training. I remember there was a time Ku Saurara actually funded the participation of many people in various trainings internationally and nationally. So that has built upon the capacity of those organizations to deliver in terms of their mandate. So that is a very important aspect of it. It has built human and organizational capacities.